Good evening for everyone. I'm Maria. I'm a senior of medical school at Fundación Universitaria Navarra in Colombia. According to Spanish Royal Academy, the term humanized is tend to describe the act of being human or familiar with something. In this poster, I'm going to talk about humanizing childbirth care of women in situations of violence and substance abuse. This is a topic of interest because some of health services don't keep records about substance abuse and violence in the pregnancy. As a future doctor, I'm interested in and fight for the welfare of people, especially for those women who are pregnant, because I consider that they are one of the most vulnerable population in the health sector due to the lack of humanization on the part of health workers. I would like to start by talking about substance abuse and what it means. It is defined as excessive use of psychoactive drugs, such as alcohol, pain medication, or illegal drugs. It may cause physical, social, or emotional harm. Obstetric violence is defined as the appropriation of woman's body and reproductive process by health personnel, which is expressed in a deshumanizing treatment in abuse of medicalization of natural processes, bringing with a loss of autonomy and the ability to decide freely about their bodies and sexuality. Finally, humanized childbirth care is based on offering comprehensive care to the pregnant woman and her family, starting with a set of activities aimed at a satisfactory labor experience, preventing the generation of feelings of lost autonomy, loneliness, lack of understanding, and perception of danger during labor and childbirth. According to Resolution 3280 of Colombia Ministry of Health and Social Protection, the pregnant woman and her family must be accompanied during the labor and delivery process in order to obtain a humanized experience from a right-based approach. This is to reduce and control complications in the labor and preparing process. This process requires an interdisciplinary team made up of a medical and nursing professional who provides adequate monitoring and support to the pregnant woman and her family. Since the Industrial Revolution in the 19th century, a series of mechanisms, procedures, technologies, and medication have been introduced to make childbirth an interventional process. This in order to provide greater safety and reduce complications. Medical procedures were gradually incorporated to the point of becoming a ritual. This often left women subjected to mistreatment and abuse which affect their physical and mental health. Research uncovered that the inappropriate use of these procedures and technologies during childbirth cause iatrogenesis, which increased the proportion of cesarean sections and instrumentation of childbirth, hindering the formation of a good mother-child bond. The purpose of this poster presentation is to compare the humanized childbirth protocol between the Colombian and US substance abuse populations. This method was a systematic bibliographic review was conducted to develop a comparative analysis of the contents of the documents, aggregating empirical findings related to a narrow research questions to support evidence-based practice. In this way, the articles referred to in the Spanish and English descriptors were used for the research. The research was executed in the GSTOR, Web of Science, Science Direct, and Academic Search Ultimate databases provided by Salisbury University Library. Keywords selected were childbirth, labor or delivery, pregnancy or pregnant, humanized care, substance abuse, violence, Colombia, and United States. According to the literature review, in both populations, approximately between 11 and 45 of reproductive age, women use illicit substance, 30% use cigarettes, and 3% drink or use heavy amounts of alcohol. Unfortunately, pregnant women do not stop using substance even though they know that substance abuse can interfere with proper fetal development and delivery care. In the United States, in 2010, 4.4% of pregnant women use some harmful substance, tobacco in 16.4%, marijuana 11%, alcohol 10.8%, and cocaine 1.1%. According to a study carried out in the Gynecology and Obstetric Service of the General Hospital of Medellin, Colombia, it was shown that the main substance of use during pregnancy were alcohol and tobacco, both with a prevalence of 45.5%, followed by marijuana with 9.1%. Of the 231 patients, it was shown that 34.6% of the patients consumed one or more of the substance at the time of pregnancy diagnosis, and 9.5% report having consumed at least one substance during the entire gestation. The use of substance and violence could impact the care the pregnant woman receives. Deshumanization varies depending on the condition of the pregnant woman. Some studies show that verbal violence, schooling, and the performance of procedures without informed consent are more common in adolescents than in adult pregnant women. In Colombia, abuse is exacerbated in part because pregnancy is considered high risk and because it is seen as a public health problem with available consequences that interfere with the social, economic, cultural, and political spheres of adolescent development. For their part, adolescent girls feel that they are treated differently because of their condition and that they receive less support from health personnel. Studies show that they receive poorer and less dedicated services than older pregnant women. According to a study conducted in Bogota, Colombia, where 16 women were interviewed who were in gestation, labor, or puerperium in the last 6 months of 2017, it was found that 55% of the women interviewed rated the care in childbirth as terrible, as they were mistreated by nurses who exercised dehumanized treatment or without adequate care. The existing US research suggests that women experience significant pressure and loss of autonomy in maternity care, and found that more than half of mothers had witnesses and physicians engaged in a procedure explicitly against a woman's will. For the conclusions and recommendations, according to the data found, it is essential to create a model in which women can receive comprehensive medical care while being treated with compassion and dignity to address the complex characteristics of addiction before, during, and after pregnancy. Humanized childbirth care is a unique approach that has been implemented in recent times. It aims to make childbirth a positive and satisfying experience for women and their families. The reduction of substance use by pregnant women is the main objective of the health indicators while providing quality care for the woman. When we talk about humanizing childbirth, we are talking about generating a family space where the mother and her baby are the protagonists. It also includes where the birth takes place in the most natural way possible. This requires a change in the attitude and paradigms of those who assist women who are in the process of childbirth. To be able to speak of humanized childbirth without violence, it is essential to know the feelings and perceptions of the woman, her companion, and her family, respecting fears, cultures, and beliefs. Health services workers must understand that every childbirth is different, and therefore the measures of care must accommodate and adapt more to who is in labor and less to institutional and professional requirements. Thank you so much. Are there any questions?